Cathaoirleach, and I'd particularly like to welcome Minister Varadkar to the House, and I can't tell him how glad and relieved I am to see him here in person, because where I come from, all of Laois in the Midlands is in turmoil at the moment over speculation and scaremongering and doubt and confusion surrounding the future status of Portlaoise General Regional Hospital, and particular regard to its A&E services. Minister, I don't have to spell out the context of this to you. It's gone on for 30 years. I've hardly got up at any stage in that year that there wasn't some doubt, some confusion and some speculation as regards to the status and future of Portlaoise General Hospital. The hospital has been, I believe, the poor relation and playing second fiddle for years for all sorts of reasons, and sometimes not least because of political bias and interference. But that as it may be, the hospital has been underfunded, understaffed and under-resourced, and therefore undermined all down those years. But I thought we were coming out the other end of that, and I thought that we were seeing light at the end of the tunnel, thanks in no small part to your own personal and direct intervention. But it's unfortunately Groundhog Day for Portlaoise General Hospital. We're back in the throes of not knowing where we stand or what the future holds. That's not fair to the staff, to the community and to the people who desperately require and need the services of the hospital on a daily basis. And Minister, while it was not a problem of your causing, it is in your solving, and it falls to you and our government to address it and not let it linger on. We had a situation in January where categorically the new CEO of the hospital group confirmed that the Portlaoise Hospital was secure, it would be retained as a Model 3 hospital, and that its 24/7 A&E services would prevail, would continue, and were safe and secure. But last week, out of the blue, with no warning, like a bombshell, on the media it was announced that there was some doubt in the immediate term regarding the future prospects for a 24/7 A&E. And I can't tell you, Minister, the shock, distress and disbelief and the anxiety that this has caused right throughout the community. Portlaoise General Hospital has a catchment, in fact, of about 200,000 of the population. It's not a local issue, it's not a local hospital. It services Athy and Monasterevin and Rathangan and Carlow and Offaly. The solution, Minister, is a resourcing issue, I believe, because if it is a question of staff and emergency consultants and emergency nurses, well then let's address it in that way and stop running away from it once and for all and saying it's not a resourcing issue. No hospital in the country, I believe, could hold up or bear up to the forensic scrutiny and microscopic investigation that have been conducted in Portlaoise as a result of the tragic and unfortunate deaths in the maternity unit. And I'm glad to say that most people now believe that you have vigorously and comprehensively addressed that issue. I'm not here today, Minister, to make an emotional appeal or, save our hospital. I believe we have a credible, coherent and constructive case to make for Portlaoise General Hospital based on merit, based on medical grounds, clinical need and community requirement. It is the only accident and emergency unit between Naas and Limerick. The ambulance network is not in place at all to start transferring people, as is now suggested, to other A&Es, which are already backed out the door. And Minister, you have seen cases of that this week in James's, in Tala, in Limerick and elsewhere. Is it proposed that we compound those problems by diverting between 30 and 40,000 cases from Portlaoise? That's what uses the A&E in Portlaoise. It's one of the busiest A&Es in the country outside of the capital, outside of the cities. It's directly located on the intersection of the M7 and M8 motorways. Minister, 21,500 vehicles pass through Portlaoise on a daily basis, twice that at weekends. Not to mention 2,000 births in the maternity unit on an annual basis, between 5 and 10 babies born there every day. And of course, as you know, Minister, babies choose not to always come 9 to 5. They're born at all hours of the night and at weekends. We also have this situation where the hospital is located across the road from 2 high-security prisons with 1,200 prison staff, and the POA are incensed and totally cannot believe the proposition that the A&E, the 24/7 A&E in Portlaoise would be closed, considering the security, health and safety and cost implications for having to transfer either staff who are attacked or stabbed by prisoners, or indeed prisoners themselves, to other hospitals which are already backed out the door. Minister, I want you to bring some clarity to this situation today, please. I'm not saying you can have an absolute solution today, but we do need a clear plan and a clear commitment to the future of Portlaoise General Hospital. And the starting point has to be an absolute commitment to the bedrock of a 24/7 A&E as the starting point for service provision and for patient safety. Because, Minister, not everyone can choose. I'll finish this point, Cahill. Thank you. Not everyone can choose to go private and skip the queue and go to whatever new modern fangled private clinics are being set up around the place. The people of the Midlands require this hospital and they require 24/7 A&E, Minister, and I'm appealing to you today to clarify the situation and tell us what is happening. Thank you.
Thanks very much. First, I want to thank Senator Whelan for raising this matter and for giving me an opportunity to update the House on our plans for Portlaoise Hospital. And I appreciate his interest in the matter and his support for the hospital through the years. I am committed to securing and further developing the role of Portlaoise Hospital as a constituent hospital within the Dublin Midlands Group. That group also includes St James's, Tallaght, Tullamore, Naas and the Coombe. Any change to services in Portlaoise will be undertaken in a planned and orderly manner and will take account of the existing patient flows, demands in other hospitals and the need to develop particular services at Portlaoise in the context of overall service reorganisation in the Dublin Midlands Hospital Group. Any decisions will be made on the basis of maximising patient safety and maximising patient outcomes, not financial considerations or political bias or political interference, to use the Senator's words. That will not be happening. In recent months, substantial investment and enhancement measures have been put in place to ensure a safer level of services at the hospital. Maternity services are being upgraded following an agreement of a Memorandum of Understanding between the HSE and the Coombe to provide a managed clinical maternity network within the Dublin Midlands Hospital Group. This will provide a single maternity service over 2 sites, Portlaoise and the Coombe, with clinical governance led by the Coombe. Agreement has been reached on the recruitment of 2 additional obstetricians, one of whom will be the new clinical lead in the Portlaoise Hospital Maternity Service, 2 neonatologists to be shared across both sites, some additional clinical and allied health support, and a broad agreement on shared services and information technology. An implementation plan will be implemented over the coming months. Furthermore, improvements in Portlaoise include a number of additional consultant posts in anaesthetics, surgery, emergency medicine, paediatrics, obstetrics and also medicine, and 16 midwifery posts. It is also intended to provide a new acute medical admissions unit and to expand day surgery at the hospital. The Group CEO set out clearly what is being proposed for Portlaoise and has made it clear that maternity, acute medical and paediatric services will continue and that elective day surgery is likely to be expanded. Patient safety and outcome must come first, and as senators will be aware, last week the HSE advised that complex surgery, bowel surgery in particular, in Portlaoise will be transferred to St James's or Tullamore, as the volumes are too low to maintain the requisite expertise of clinical staff. Indeed, the HICWA report specifically criticises the HSE for recruiting additional colorectal surgeons at Portlaoise when patient numbers were not sufficient to allow them to maintain their skills. So often it is a matter of patient volumes, not just staff or resources. You need to have both and be able to sustain both. As a result, we will see the discontinuation of undifferentiated surgical cases that present at Portlaoise Emergency Department. The important point to understand is that the work is being done to strengthen services in Portlaoise from a patient safety and quality perspective, and also to ensure that services are currently provided by the hospital that are not viable or discontinued, and those that are viable are safety assured and adequately resourced. This is in keeping with the recommendations of the HICWA report into services at Portlaoise and indeed other hospitals in the past. I am confident that these changes will improve services for patients at Portlaoise. In relation to the emergency department specifically, as the Senator points out, it receives between 30,000 and 40,000 attendances a year. Therefore, there is no question of closing it. The only question that has arisen is about whether 24-hour services are sustainable, and that they have been raised by the CEO. No decision on that has been made or can be made yet. I would point out that Navan, for example, no longer has surgical services but continues to offer a 24-hour emergency department for medical patients and minor injuries as well. And I certainly strongly agree with the Senator in that I don't think that any proposal to end 24-hour services at Portlaoise could be advanced without a clear and credible plan to provide additional capacity in places like Tullamore and Naas and Tallaght, which are very overstretched at the moment.
Question, Senator.
Yes, thank you very much, Minister, for your comprehensive reply, and indeed departing from the prepared script which I have in relation to the A&E aspect of it. I would put it, Minister, that there is an incontrovertible case to be put regarding the retention in absolute terms in perpetuity for 24/7 A&E at Portlaoise, based on patient safety, based on demand and based on the requirement to serve a huge population catchment. And I don't believe that no matter what alternative ambulance services or otherwise you would put in place, it would be possible for that volume of care in a 24/7 A&E to be diverted for or coped in any of the other hospitals, as is somehow being suggested. I also beg to differ on one point, Minister. I do think that the Group CEO did add to extraordinary confusion and was not clear, went on the airwaves without consultation with anyone, and certainly not the public representatives or the community, and created a great deal of anxiety by speculating as to the future prospects for 24/7 A&E, which, as far as I am concerned, it would be an untenable position to consider phasing those out or bringing them back to 8 to 8. It is no longer an A&E and it is no longer an emergency department, Minister, unless it is 24/7. Thank you.
I suppose that there are a few things to bear in mind. I know the Senator and I know all the deputies, not just in Laois, in every constituency, would love me to be able to give somebody a guaranteed cast-iron commitment that services remain 24/7. That's not something I can give to anyone about any hospital in the country. Medicine changes over time, and even when decisions are made, you can have difficulty finding senior staff, and it's not tenable in the longer term for us to continue to provide services with locum doctors and temporary doctors and doctors who aren't fully trained to do the job that they're expected to do, and that's a problem across the country. The international standard now for an emergency department is something very different to what it was in the past, and that is essentially a department that can take undifferentiated patients, a patient that has absolutely anything wrong with them, and deal with them. So that's, for example, somebody with a major head injury who needs neurosurgery, somebody with a major injury to their chest who needs cardiothoracic surgery. Portlaoise has never provided those services, and it has never been what we would now describe as a major trauma centre or an emergency department in an international context. If you take somewhere like Scotland, there's only 2 of them. If you take somewhere like London, there's only 4. And the catchment area required for that type of emergency department, a major trauma centre, is a population of about 1 million. And obviously that would mean somewhere like 4, 5 or 6 in Ireland. But nobody is suggesting for a second that we only have 4 or 5 or 6 emergency departments in Ireland. But we are going to have to look at emergency medicine and reconfigure it so that we've got the right sort of services in different places. And the only guarantee that I can give people is that any decisions that are made will be made based on what's best in terms of patient safety, what's best in terms of clinical outcomes, not based on financial considerations or political bias or political interference. None of those things will happen.
Thank you, Minister.